We're live.
Woohoo! Hello, everyone. Sorry for our tardiness. I'm just kidding. We're just finishing up getting ready. Welcome, settle on in. Let us know when you're coming from. Today, as always, I'm very excited for our special guest that we're going to be having on here shortly. We're just running a little behind today, so not to fret. It's not you, it's definitely me. Don't worry there. Let us know where you're coming from. If you are just joining us for the first time, welcome to a Hi Mama webinar. We're going to be running through some great questions today for our special guest. I'm super excited, and which I'm not going to give away just quite yet. But anyways, from sunny, warm Toronto today, absolutely beautiful weather. As I won't lie, we've been pretty spoiled this summer. It's been absolutely awesome, and we've had some fairly nice weather for the fact that it's COVID. But anyways, as well as you guys roll on in, I'm gonna give this guy a start. Just let us know, who you are at your center, where, just to get a better demographics. There's a poll here just to give you guys, we want a better idea of like who's joining us today. So to have a little bit of fun with that, you'll be able to answer it up in the chat. Welcome, everyone. It's Thursday already. I don't know what happened, but it's August 20th, and life has just flown by. I feel like it's crazy, like the time has just crazily gone by. Lots of teachers on with us today. Fantastic. Get a better idea. We're going to do another one. I'm going to end this one up here. Just wanted to get a better idea. If it will go back here for me. There we go. Very excited. Let me know. Have you heard about Hi Mama before? So we want to know if you are a customer, if you've heard of our app, but never really done anymore, which is cool. Or if you're first time, if you've never heard about us, where have you been? I'm just joking. We can definitely send you on to the right information if you're looking for a little bit more. Okay. We're just going to give it 2 or 3 more minutes just because we brought you guys in a little later than we normally do, but to settle on in. Hello, Diana, I think that's what it was. You said your birthday's on Saturday. So is my niece. That is the big thing. I can't lie. I don't know where the 4 years have gone with this little crazy child. I don't know where they've gone. Best 4 years. She brings us so much joy, laughter, you name it. And she is a spitfire. So 4 going on 19 in many ways. It's amazing. So happy birthday to you there. Hello, Hi Mama customer Amanda. I got there, guys. I'm getting better at the chat. It's only taken us how many webinars to get here? 2 or 3 more minutes, guys. Then we're going to settle on in. So if you haven't had your chance to get a glass of water, you haven't had your chance to just run to the washroom quickly, please do. We're not quite settling to start up here yet, but we will be in a minute or two. If you're just joining us, let us know where you're coming from. Hello, Calgary. I saw New York, Texas, PA, South Carolina, California, Chicago. Lisa's never heard of Hi Mama, guys. What are we going to do? I'm just kidding. Lisa, if you want to learn a little bit more, we can definitely pass you on to, if you want to go in and check us out in high detail, if you want to read some more, we have so many things we can pass on to you. So, going to get started here in a minute. Not to fret. Welcome, West Palm Beach, Florida. Wonder what the weather is like in Florida right now. It's as hot as it is here. It's pretty hot here, but it's nice. I'm not going to complain. All right, you're in England. Jackie, I think it was Jackie. I'm not sure if I was saying it correctly. England. Wow, that's amazing. Mississippi, hello. Hawaii, hola. I'm so excited. Okay, guys, before we dive in, I have to say that I am so excited for our guest today. Like I've said this probably 3 times now already. Very, very excited. Toronto local lady, And by no means, like, she's got so many acronyms after her name that it's unreal. But on the same side, I am just super pumped to have her on and talking in a bit of a different concept as well about children that I don't think we've really covered. Hello, Jamaica. I don't think we've really covered in the last several weeks. So this is very exciting to have. I'm just super pumped that she's joining us here. So let's dive in. If you are just joining us, please settle on in. Let's get everything rocking and rolling. And as per usual, everyone knows the session is recorded. So if for whatever reason, audio is crazy. Hello, Nigeria, welcome back. But for whatever reason, if your internet is wonky, if you have to run, whatever is going on, please don't be afraid. If you got to go do your own thing, you do you. We record, we send this on tomorrow with some show notes, any links, everything. Certificates will be available, not to fret there. Everything will be covered. You guys will be good to go. So let's rock and roll. So if you've never joined us before, I'm Ria. I'm the early childhood educator specialist here at Hi Mama. I've been with Hi Mama for just over 2 years now. And in the back on chat, say hello to Carmen. Carmen's my co-partner here in crime.
Hi, everyone.
Please send all your fabulous questions to this lovely, lovely lady. Carmen is the background, the backbone, you name it. Carmen makes this work, guys.
That as usual.
Please say hello to her on the chat. She's fantastic. Carmen's the one who will filter every question. She gets them onto me in case I miss it, just because everything goes so quickly, guys. Our special guest today, very excited, Dr. Dina. She's a pediatric doctor that works here in Toronto. So I'm super excited. She's got a great family clinic here. And I can even say that we have a couple of our coworkers, they actually go and see her with their children. And, at the end of the day, I'm very excited for Dr. Dina to come on and answer some of our questions, especially around, we're getting ready for back to school. We are getting ready to really, get into the thick of what could potentially be changing because of COVID. So at the end of the day, though, always like to cross our fingers, dot our I's, cross our T's. Just remember that this is not your face of legal advice. Okay, everybody, say that with me. I'm not your face of legal advice. I didn't go to law school. No, I didn't. Definitely did not. You do not need me in front of any judge. Anyways, if you're looking for any sort of legal advice, please don't be shy to go around, find somebody in your area who can help you out, obviously. And of course, if you're looking for any licensing or anything like that, you can consult with either your officer there or whatever's going on. Okay, just make sure that you are seeking the right people for the right reasons, not me. Today, we ideally want you to take, content away. We want you to take tips. We want you to take tricks. We want you to be able to, implement things at your centers that will work for you guys, or try things and pass on information, and ideally work out the best of the craziness that's going on today. So couple of pieces of content before we dive in with Dr. Dina. So don't fret. We will get in with her, but we just want to cover some great things that we've, learned over the last several weeks. And I want to make sure that, reminders are getting out there on a day-to-day basis. And a couple of things that I think, especially we've learned over the last, I want to say 4 weeks, in reminders and tips that have been coming, especially, we had Missy on the other day, we had Tessa on the other day. Fantastic to be able to, get some reminders out of that. So can't stress this guy enough. We all know these, but I also really wanted to, as we dive into the school year, as we dive into, some of you have already started, some of you are looking at starting. So I just want to make sure that, these are at the forefront of minds. And ideally, I think if you're following these, personally for me, when I think about all of these little pieces in my life right now, I just think it helps me bring down my anxiety. So just to remind yourself, they're there. A lot of these recommendations are being made so you can be a little bit more at ease, but as well, you're staying safe. So remember to wash those hands. My mom always used to say to me, it was singing ABCs twice. Man, I've been singing so much. Now I'm starting to find like other songs. It's my favorite part in regards to actually washing my hands, and then followed by the lotion, because the eczema on this is ridiculous. Keeping up with those masks. Hey guys, get creative. I got myself my very first cloth mask the other day, and it's fantastic. Like, I actually really love it. Don't get me wrong, it's not an easy wear. So at the same time, do your best there. Wanted to point out, here in Toronto, if you have not been around us, or if you've not seen any of the crazy signs that we have when it comes to physically distancing, one of my favorites is this one, which is stay 3 geese apart. 3 geese is 6 feet, apparently. And if you've never seen a geese, they're massive. Anyways, I've seen one where there's it's like 20 curling balls, or sorry, curling rocks. I've seen hockey sticks. I have seen so many of these signs, and they actually make me laugh pretty freaking hard every time. So, remember to just keep your distance from people who you don't need to be that close to. You can still have conversation though, folks. All right. Get your cleaning out. My mom is so proud. The Dutch in her. She's just so happy to be cleaning all the time now. She was cleaning before, but now she just takes it to an extreme level. And, but hey, whatever floats her boat. Remember as well, and this is where it's really hard on this one to, keep your hands away from your face. I'm an eye person. I always rub my eyes. And so just being a little conscious, especially for me when I'm out in public, I'm just thinking, okay, I can just take it back a notch. Okay. And I think the other one that kind of goes by the wayside sometimes, guys, is just monitor your own health. Take some time. Remember to find some time to reduce some stress for yourself, and make sure you're in your right place, as right as can be. And if you're needing a bit of support, please, find some support, whether it be professional, having a chat with a close friend. It's, at the end of the day, it's important for you. So speaking of help, mental health right now, especially as we return to school, or get your center back in gear and get going at the idea, you want to make sure that the kiddos and the children are ready to, Michelle, Canada geese are beautiful. I'm sorry, I got off topic. You've never been bit by one. I'm just joking. It's painful. Anyways, they're very, very beautiful. At the same time, you just don't want to be that close to them. So take some time though, shifting back. Watch the mental health of the children as they come back today. Many children have been out. Our children here are just about to go back to school beginning of September. I know somewhere in the States, you guys have already started school. Some of you are waiting, but, take some time to keep some cues from those signs of anxiety. Tessa was talking about these last week when she was talking about trauma, when she was talking a little bit more about, being aware. So just make sure to keep your eyes out on those children as they're coming in, and help them focus on what they can control right now. So their emotions, their behavior, their doings, their whatever it is that's going on, they do have that control over those things, and it just kind of help ease some anxiety. Okay, all. Keep some positivity. I know it's hard right now, but at the same side, I think, well, at least here in Ontario, guys, we're doing all right. We're on the up and up, but at the same time, you got to keep yourself vigilant, but keep some positivity in there. And like I'd mentioned, if you're needing any help, if a child is needing any help, please, please, please seek some help professionally. It's super important. I see a couple of people here in the chat. Some people are going back September 7. It's small groups. Yeah, I think that is, like, for the most part, the big things that are happening today. So some tips. Like I'd mentioned the other day here, we had Missy on, and she revealed a couple of hacks that she learned from being open for several weeks. And the balance for her, they're still doing, a couple of kiddos are still not back. A couple of teachers are still not back, but at the same time, they're ramping up. So make sure you guys have a plan. Make sure to stick with it, especially within your classroom. And it's as sad as it is to see the toys that have to leave the classroom right now. It's a temporary state, and we will get through it. But at the same time, you want to be able to clean everything and make sure that, you're providing the safest environment possible right now. So I see a couple of people have gone back July 7, which is great. Oh, and things have been great. Excellent. Exactly. You guys just keep following your cleaning procedures. And I think if you guys just keep sticking to it, it's going to be, won't be a smooth ride, but I think the bumps will be less big. Okay. One of the things Missy had pointed out, and of course, if this is allowed, your personal sensory bins, unit to unit, health unit to health unit can be a little different depending on where you are. Some are saying no to everything. Some are saying have the personal one. Some say open or wide. No, they're not saying wide up. But in those personal sensory bins, if their children are using their own things, I don't see why it won't be open. Maybe if it's anything you can discard later that can't be washed, that'd be my thought. Picking of toys. This was one of the big things here that I wanted to make sure that, let them pick what they can have. And I think it'll actually make that toy going away sort of motion not as difficult. Okay. Make those temperature checks as fun as possible. Hey, a lot of kids, they don't actually really know what's happening. So don't worry about it. Okay. Make those hand washing routines fun. Like I mentioned, those singing those songs or even playing a game in that moment, a really quick one, of course, you don't want to drown it out too long. And taking time to get the children to get to know them a little better. I know when we had less children in the classroom, on days that whatever had happened, I wanted to make sure to take the time to have more of a relationship with the children that were in the room at that time, for whatever reasons it was be, vacation, things like that. Make sure that you take some value in the fact that, yes, the ratios are a little smaller now. So I know that it's not easy in times, but quick, because I want to get to all the good, juicy business here. The mask tips. These are a couple of things that I actually found across like the CDC guidelines and a couple of places here in Canada, just to help make it a little easier, especially if you do have a child who's a little anxious about the mask. I could say on my part, the children I've been in contact with, they're not really fussy, but I know some children can be very, very anxious about this. So pop on, a mask to a stuffy or like their favorite doll or something, and have parents potentially do that at home if they haven't rejoined the center yet, just to kind of help them get used to it and those sorts of things. Taking a picture. This one I wanted to point out, I saw it way back, and I believe it was in April, where it was one of the nurses from Sick Kids, which is one of our local hospitals here. She had a pin with her own picture, no mask, but then of course wearing her mask herself, and or a tag or anything like that. You guys could potentially do a lanyard. Be careful, obviously. I'm sure there'll be some pulling for the younger kiddos. And as well for the children who are getting ready to roll back into the center, if you haven't actually had them come back yet, I would personally send out a video, guys. Have one where you're wearing your mask maybe to start, take it off after, then pop it back on at the end so the children can see that that's you under that mask. And I think that it will definitely bring on some positive outlook on wearing masks. And it's totally, anxiety will be there, folks, but I think we're going to get through this. With all this said and done, I want to bring on the lovely Dr. Dina. And so come on, Dr. Dina, bring on that video. We want to bring you in, chat through a couple of great questions. Yay!
Hi, everyone. Hi.
Welcome. So Dr. Dina, I was saying a little bit earlier, we have a couple of coworkers who have patients with you, which I think is absolutely amazing. No naming names, of course, patient confidentiality, but at the same side, I'm so excited that you're here to have you on. You're our first doctor. So before we dive in too much, just a small intro of yourself and Kid Crew and what you guys do over there and a little bit about what you're doing.
Sure. Yeah. Thank you. Hopefully the internet connection's okay. For me, you guys are a bit choppy. So can you guys hear me okay? Is it clear?
We're good. Yep.
We're good? Okay, perfect. Good. So my name is Dr. Dina Kulik. I am a pediatrician and I'm a pediatric emergency medicine doctor in Toronto. And I am the mom of 4 young boys. My kids are 2, 5, 8, and 9. And I have a clinic called Kid Crew, as you mentioned, which is a multidisciplinary clinic in Toronto. We have many, many thousands of patients, and we're a busy place. We have primary care. We have all the different specialties, so like dermatologists and respirologists and gastroenterologists, the whole gamut. And allied health people like speech therapists and psychologists and social workers. We say we're one stop for kids' health. We're kind of
That's amazing.
You not have to go elsewhere. That's me. That's me in a nutshell.
That's amazing. Well, let's not take too long and dive into all of the fun stuff. So of course, this is the talk of everything today. And of course, symptoms in children have been like a huge a huge question mark, especially as people do go back to school, as centers reopen. Maybe if you could enlighten us a little bit on what would be, what the list, maybe not the whole list of symptoms, but talk us through some key symptoms maybe some educators could be on the eye out for as they do start to roll back into the centers today.
Sure. Yeah. So we used to think, and I think a lot of people still think, that COVID is predominantly a respiratory virus. And I can tell you that that's not the case.
Yep.
What I know from practicing, working in the office and working the Emerge, is that COVID is everything and it's nothing. And what I mean by that is that it's pretty clear to me that COVID, is difficult to detect on testing. So a lot of kids that have had viral illnesses, whether, people thought it was stomach flu, but the test is seemingly very, very inaccurate in children.
Oh, wow.
So even if your child has been sick, or someone in childcare has been sick and they had a test and the test was negative, personally, I don't recommend putting a lot of stock in that. I think that every child that has any kind of viral symptoms whatsoever should be isolated for 14 days, because we just don't have the testing available that's very accurate yet. And because there's no gold standard for testing, there's nothing to compare it to. So we really don't know if a test is positive or negative. So if a child who's symptomatic, and we'll talk about that in a second, has a COVID test and the COVID test is negative, I still think that pretty much every viral illness right now is COVID. I really do. I think we're going to find out more and more as we go. Again, this is novel, so we don't really know that much about COVID truly, that all these kids with stomach flus, quote unquote, all these kids with roseolas where they have fever for a few days and they're irritable and they have poor sleeping and then they get a rash, these kids with roseola, as we call it, pink eye, all of this is probably COVID. Quite honestly, this is my thought. We don't have any proof of this yet, but just having seen many kids, even during quarantine, that were getting these viral symptoms. So COVID is everything. It's all viral symptoms as far as I'm concerned. And I feel like very few kids actually have cough as their main symptom. It's not like a typical respiratory virus, but also it's pretty clear that most people are completely asymptomatic. And I say that because I have many families whose parents had COVID, or one parent had COVID and one didn't, and their kids had symptoms or they didn't have symptoms, but they all have it because it's so very contagious. So it's every symptom and it's no symptom. And that's why it's so difficult to detect. And that's why it keeps on spreading around the world in such huge volumes.
That definitely makes it very difficult, like you said, in the testing regard, to just really find out exactly where it is and what's going on. Now, if as a child does test positive, and let's say they are in a classroom, wherever that classroom may be, what's the likelihood that the teacher has it or other children in the class have it as well?
If there haven't been things like masking or social distancing, I think 100%, to be honest. Again, because we don't know how accurate the testing is, but we know it's ridiculously contagious and that many hundreds of people have been infected by one single person in one single setting. So my assumption is that if one kid in daycare or school has it and they're not, more than 2 meters away from each other, they're not wearing masks the whole day, et cetera, that the other people in the class are at high risk of getting it, even if they don't have symptoms, which could mean you could take that home with you and infect family members and other loved ones.
And then from there, the growth just keeps going.
That's how it happens, right? So one person has it, they give it to 5 people, who give it to 5 people, who give it to 5, that's how it goes.
Very much. So speaking about like those safety measures and things like that, and I know especially here in Toronto, we're still working on like the rollout plan with back to school and what it will look like, and of course what the classrooms will look like. Do you have any tips on what would be, to help prevent COVID from, spreading, whether that be in a classroom or be in a childcare facility?
It's quite clear that when people are close together, particularly inside, that's where we see outbreaks happening. So even in places where they are back in school, for example, like South Korea right now, where they're wearing masks and they're physically distanced, we're seeing outbreaks again in places where people are congregating inside without wearing masks or without maintaining that distance, social gatherings and religious ceremonies and bars and places like that. So being outside as best as we can, that's doable in some parts of the country and not others for very long, of course. Wearing masks, we know, is very protective. Maintaining that physical distance of, 6 feet or 2 meters, good ventilation, opening windows, again, being outside, things like that, and really, really diligent hand hygiene. We know that COVID can be transmitted by droplets from person to person, hence the masks, and also on surfaces. So if a child or an adult touches a surface and then touches their face or rubs their eyes, as you were commenting before, we know that this is a way that people can get COVID.
So in regards to kind of changing gears from school to childcare facilities, you know, a lot of course, parents are trying to go back to work. So they're taking in their infants, they're taking in their toddlers. And of course, that is like any toddler, your mom, your doctor, you know this, mouthing, putting toys in their mouths or touching their faces is very, very, very difficult for them to not want to do.
It's impossible for a little kid to not touch their face. And if you say, don't touch their face, they'll touch their face more.
Oh, exactly. It's like they do. Do you have any like best practices potentially for that area, that age group, to just kind of help provide, well, you know, safety, but still giving some meaningful interaction as they grow?
Yeah. I mean, to be honest, I really don't think we can really convince our kids, you know, toddler age or younger, to not touch their face or their mouths. We have to anticipate they're going to. And that's why it's really, really paramount that we keep, you know, small cohorts and we keep really good hand hygiene and we stay away from other people as much as we can. We stay in our bubbles. You know, I anticipate that kids going back to daycare and the younger kids going back to school, they are going to be exposed to each other. And I'm just assuming they're all like licking each other, basically. So that's why we have to make sure that every one of those kids is healthy and every one of those families are healthy, because my assumption is that they are like all super sharing of germs, right? Mm-hmm. If you tell a 1-year-old not to touch their face, like, I don't know how you plan on doing that, really. They're going to put toys in their mouth. They're going to touch their friends. They're going to lick their friends and bite their friends sometimes, right? So we want to maintain distance in some way, but I don't want to scare them either. And a 1-year-old cannot be taught not to pick up toys and put them in their mouth because they're exploring with their mouths. It's another form of, it's like a sixth sense, if you will, right? Yeah. So it's going to be difficult to teach that. Certainly a child, like, my second kid is 5, he was sucking his thumb until like a month ago. And we had a lot of conversations about how we really can't do that. And here are the risks, etc. Before that, I didn't really care so much. Now thinking about going back to school, I'm like, Jason, we got to get this under control. And it was amazing. He stopped. He totally got it. And as hard as it was for him to do, he absolutely stopped sucking his thumb. So for older kids that we can have a conversation with and really discuss, the risks and all those things, go for it. Absolutely. In a non-scary way. I don't want them going back to school and being terrified of everything.
Yeah. It's like listening to too much social media at the same time, right? You don't want, there's no reason for them to have unnecessary stress over things that you can have a decent conversation with that child about. So it's very powerful.
100%. Yes.
I know we've been saying, one of the ladies here, because we were talking about masks, but she wanted to know, do you advise about babies wearing masks? I know we've seen pictures of media.
No, kids less than 2-year-olds should not be wearing masks, period.
It's just,
they can't communicate effectively. They can't tell you if they can't breathe properly. Yeah, suffocation. It's a risk. They can't talk to you. They can't communicate that it's not safe. And again, I've never seen a less than 2-year-old that doesn't touch and pull and move it. Even me, as someone who wears a mask, clearly I'm not wearing a mask now, but I'm wearing a mask all day, every day when I'm seeing patients. It's annoying not to touch it. I have to really think about not touching it. To tell a 2-year-old, I mean, I don't even know about like 3 and 4-year-olds wearing masks, to be honest. I think that's a really hard thing. They'll get used to it. We're going to train them, but it's going to take some getting used to. I can say that as someone who wears a mask every day, they're not comfortable. Less than 2 should not be in masks. Kids with developmental challenges and delays should not be in masks.
I agree 100%. So going on with some, because you were saying you were talking with your son about communicating with him and things like that. Is there any tips that educators that you can pass on to them for parents about monitoring their children's health at home, say if they start seeing signs of something? And would you recommend that they go see a doctor like right away for a doctor's note?
I think if your child is sick, and this is always the case, I think you touch base with your physician, your healthcare provider. I don't think you necessarily have to rush to the emergency room, for example. If your child's unwell, do that. If your kid is not breathing or not drinking or is losing consciousness, etc., go to the emerge, as you should always do. But if your child is, has a runny nose or a bit of a cough or a bit of diarrhea, this is the time to check in with your physician, your provider. I understand that a lot of people don't have access to providers right now. A lot of doctors are not working, but there's lots of virtual options. At Kid Crew, we're providing virtual options to our patients, and actually anyone in Ontario that needs extra help when they can't see their physician. There are opportunities like that wherever you are, I'm sure, whether you're in the States or in Canada or whatever province, etc. If your child's unwell, don't go to daycare, period. Please don't push this. A lot of us, I know, we're eager to get back to work. I'm like, oh, it's just a runny nose, as people have always done forever, sending their kids back to daycare and school when they're just like a little bit sick. There should be zero tolerance for any of this now. The reliance on testing, the reliance on thermometers and temperatures is not accurate. It is not reliable. So just because a kid has a runny nose, had a COVID test and was negative, I still think they have COVID. Just because a kid no longer has a fever today, they still probably have COVID, really. So I think zero tolerance for any illness. And personally, if there's any illness in the home, I would also not send the kid back to daycare. And personally, conservatively, I would think 14 days, not a day without fever or a day without, a COVID test that's positive. I really think we should be sticking to 14 days. Otherwise, we will be seeing more outbreaks.
And then it will just, like you'd mentioned before, grow and grow and grow. Yeah, exactly. So
and unless we want to be shut down again and quarantined for months again, we need to be really cautious. We can't, this is the time to be patient. People are not patient. We can see around the world places that had outbreaks where, probably everyone knows someone that died in Wuhan as an example, right? Because it was such a problem there. Even New York City, everyone knows someone in New York City, if you live there, that got sick or died. And yet people are having parties again. Like, it just happened. I don't understand what the impatience is. It's really mind-blowing to me. Be patient, or this is going to take a lot longer to get back to normalcy.
It's very true. And I agree. People have not been patient, and it's showing, and you can tell that. And all of a sudden now the cases are through the roof, right? So
yeah, 100%.
So I want to step away from COVID a little bit, not really, but the long-term effects. And in long-term effects, I'm talking a little bit more about, we've had lots of conversations and questions around the social interaction and that physically distancing, and of course that potentially putting children at regression, especially those younger children. A lot of educators are very worried about this right now. Do you have any thoughts just around that impact over the course of, let's say, the next couple of years for those children who are that 2 to 5 range right now?
Right. I mean, I think every family is different. Every child is different. Some kids really need to be with other kids all the time to be kind of okay. And other kids are pretty okay and they're social no matter what, and they're able to get by without as much social interaction. But, not being in daycare, not being in school isn't like locking them in a closet. They're still with you. They're still with other loved ones. You probably still have a bubble of a few other people. So they're not socially isolated. Just because they're not in a daycare setting or a school setting doesn't mean they don't have any social experience. And around the world, there's communities that have kids that are living, let's say, with grandparents during the day, and they're not in a daycare setting necessarily. So they may not be getting the same social interaction as we're expecting with daycare and school. And these kids are doing just fine. And they did just fine for generations. So I think we don't have to be worried so much about the social piece of it. Again, they're not isolated. They're just not in a daycare or a school setting. I think we're relying a lot on screens lately, and that makes me nervous, actually, more than the social isolation piece that people are concerned about. A lot of kids are spending an awful lot of time on screens, and there's nothing more socially isolating than watching a screen all the time. So this makes me more concerned than not being in daycare or not being in schools. But, at the end of the day, as I mentioned, the longer we go on with this and we keep pushing our luck, I think the longer we're going to be in, potentially quarantine again. So patience goes a long way. But I don't think that most kids are going to have a big challenge in terms of socialization, as long as they have caring, loving providers who live with them that are going to keep socializing with them.
Very true. And I never actually really thought of it in that aspect. I think I was thinking more of in the aspect of, child to child interaction versus, I can talk with, my niece. I
mean, look, they're beneficial, of course. I mean, it's beneficial, of course. I mean, I'm not saying we shouldn't have social interaction, but there's a lot of panic going into this. We got to go back to daycare or the kids are going to be not okay. But truly, if you look around the world, very huge populations of people don't go to daycare. It's just not normal where they live. And oftentimes, like I said, they're being brought up by grandparents as parents go to work, and they're with a grandparent or two and not a lot of other kids. They may not have siblings. Plus, if you add in siblings to the mix, many people have siblings. That is a social interaction. It doesn't have to be a child exactly your child's age for it to be considered to be socially enriching.
Very true. Very true. Turning to that older age group a little bit, we've been out of school, especially, and I'm sure your sons as well. You guys have been out of school since March, and everywhere else has been that. Do you feel like any of the children that are older will have regressed from missing those last couple of months of school? Do you think the children who are going into kindergarten are really going to struggle this year?
I really don't. I truly don't. I don't think that kids are going to have a difficulty in terms of socialization. They've been off of it for a few months, but again, I don't know of a lot of examples, a lot of situations, even in my own patient practice, where kids have literally seen no other kids for the last 6 months. I just don't know of that. Most people have bubbled with other people, or again, they have family members that they have had social interaction with. The screen time thing though, like I can't overemphasize that I am very worried about that. I've spoken to dozens of families, hundreds of families over the last few months where kids have spent the entire time in quarantine on screens all day, every day. And that is very isolating and is not good for mental health or physical health for that matter.
Yeah. And so if in regards to it, like changing into that mental, that physical health with those children, is what's the like repercussions of being on the screens for those hours on ends in children's development?
Well, if it's ongoing, it's bad for you in tons of ways, right? So less social development, poor emotional IQ, poor academic IQ, obesity, high blood pressure, poor vitamin D levels, all sorts of things in terms of mental health. So anxiety and depression and poor sleep, all of it is bad for you, you know? So, kids less than 2 should get 0 screen time per day, 0 in kids less than 2. That is an academic recommendation from the Canadian Pediatric Society and the American Academy of Pediatrics. That is firm. Kids older than 2 and less than 5 should get no more than an hour a day, total screen time, anything, tablet, iPad, computer, games, TV, etc. And kids more than 5, no more than 2 hours a day. I am seeing that rarely occurring in the patients I've been taking care of over the last number of months. They're often getting far more hours than that, sometimes 6, 7, 8 hours a day of screen. And that is isolating.
Very. That's very scary. And I never really thought about the long-term effects of that. I think maybe in the back of my mind I did. But for the long haul, then, of course, with us going virtually for some of the classes, and of course, more aimed at those older teenagers. But the fact that some schools are choosing to go back virtually, at least for the beginning. How do you think we should prepare for the long haul fight against COVID?
I mean, if we have to be virtual learning, we have to be virtual learning. I think I would minimize the time in front of the screen. So, my own kids' school, they're going to be going back, if they go back virtually, would be 2 hours a day of fully, virtual learning in terms of like streaming into the classroom setting. And then they would have another 2 hours a day that is virtual, but it's more like the teacher would present, okay, do this project for the next half an hour, turn off your screen, and then come back to us and we're going to talk about it. So it's not the whole 2 hours straight. And for them, for my own kids, they won't be getting screen otherwise. So I'm not going to also let them watch, 2 hours of TV a day or play gaming systems or whatnot, because I already know they're getting a lot of screen during virtual learning. And then otherwise, they're out running, they are moving their bodies, they're being active. It doesn't have to be like sports per se, but they're moving, they're running, they're biking, they're playing hopscotch, they're just moving their bodies, because a lot of this is creating a lot of sedentary behavior, which we had before and we're only having much more of now.
So for you as a mom, are your kids going back to school in September, or is it a mix for you guys?
I actually don't know. I haven't even decided. I'm waiting to find out from our own school how many kids are going to be in the classroom setting.
Fair.
I feel much more comfortable for it to be less than 15 kids per class, but I'm not sure that's going to happen. We know that there's less than 15 seems to be doing better than more than 15. Certainly if they were going back to a 30 kid classroom, that wouldn't be happening for my family. I just think it's too much risky risky behavior there. Yeah.
No, fair enough. And then that's different, I think, across the board for, especially in like my brother's sending his kids back to school, but they are doing less than 15 children in the classroom.
Yeah.
So it's
and then taking all the same precautions as daycare settings, right? If we're very cautious, we haven't had huge outbreaks, even across Canada, but particularly in Ontario, kids went back to daycare and there have not been huge outbreaks here. The numbers have remained stable. So with the smaller groups, with masking when we need to, with good hand hygiene, with lots of outdoor play, minimizing group sizes, people have been done really well. We could just model that and continue that and avoid these big group settings. We know how to control this. We just have to be patient and wait it out in those small groups.
I totally agree. Is there now in your practice that you've been doing so far, is there any way or somewhere that parents can look for some resources or educators on the topic if they're looking for anything? I know there's so many things out there right now. But do you have any off the top that parents might be interested in checking out?
For sure. So, I share tons of information on social media. So I'm at Dr. Dina Kulik, DrDinaKulik, across pretty much every platform, from Facebook to Instagram to TikTok. I'm everywhere. I have a blog, www.drdina.ca. I have tons of blogs there, like 800 blogs from many, many different practitioners on everything from ear infections to swimming to speech development to motor milestones, kind of everything there. So lots of information there. Of course, the World Health Organization, the CDC, your own public health community, wherever you're living, all those places are good sources of real information. And there's a lot of myths out there, a lot of pseudoscience, a lot of people saying they're doctors of all sorts that are touting lots of nonsense, lots of stuff that's very dangerous, really. All this, anti-mask craziness, people saying it's unsafe, it's harmful, it's toxic, all these things. It's really very risky. And we can see where we are seeing a lot more of that, like the US, they're doing so poorly. Like it's devastating what's happening in many parts of the world. So we know how to do this well. Wear the mask, keep small groups, keep your hands clean, stay home if you're sick. We're doing it well here in Canada. We're doing really well, but we have to be patient and just wait it out, really.
I think, Dr. Dina, I was going to ask you what your key takeaway was, but I think you've kind of just summed it up right there, and especially the being patient part. But is there anything you'd like to add in, like, of course, in your experience over the last couple of months, is there any key learnings or takeaways that you want to share with everybody before we dive into open Q&A?
Sure, yeah. I mean, I think we're focusing so much on the negative, and COVID sucks. There's no doubt about it. It's really hard, financially, emotionally. We're exhausted. A lot of us have been home with our kids for a number of months, and it's really hard to be a parent at easy times. And it's very challenging to be a parent when you're at home with them, having to entertain and clean and educate them. And it's so much. And we're also overwhelmed and stressed out. And I totally get that. At the same time, I also want us to spend a little bit of time, if we can, sounds a bit hokey, but like focusing on the silver linings here, right? We've gotten to spend all this time with our children that we otherwise wouldn't have had. We're forced to, and that's hard. So there's babies crying behind me. I don't know if you can hear that. Sorry, next to my patients. We've gotten to spend all this amazing quality time with our kids, like forcefully, and that's hard at times, but it's also amazing at times, right? For our kids that are otherwise at daycare or school, we don't see them all day, every day. And seeing them all day, every day is hard, right? Mm-hmm. But it's also amazing. We may not get this opportunity again unless we forcefully take that opportunity. So there are, the slowing down of life can be really amazing, and it's going to be over probably before we know it. It feels so long. It's like the early days of parenthood. Every day feels so long. You're like not getting good sleep, and feeding is a struggle, and they're, we're up multiple times per night. It feels like every minute is so long. And then you wake up and you're like, what happened? Like, my youngest is turning 3. I don't even know how that even exists. I just had him. So things like this is going to feel so long, and then it's going to be over, and we're going to look back, and it probably won't seem so bad, to be honest, because it'll be over, just like, the sleepless nights in the first few months of life. And we have to really, I think, savor the opportunities to be with our kids now. And hopefully people will move forward and take those opportunities more than we had before, and really savor them and feel that silver lining that is there for us.
That is fantastic. Dr. Dina, it's been a quick pleasure having you on, but we have some great questions from Open Q&A. And just for the audience, if you guys want to let us know any more questions in the chat, we also posted Dr. Dina's information there as well in the sticky tab at the top. So if you're looking for it, Carmen did that. Couple of questions, sort of like a nice little jumble, but I'm really bad with names. So Donovan, I believe if I'm saying that right, she asked if a result of being asymptomatic, what do you think of the Ontario government's lack of mandating masks and the increase of class sizes?
Comment.
Yeah.
I'm sorry, I missed some of the question because it was quite choppy. I'm not sure if it's on my end or your end.
That's okay. It could be a combination.
Maybe repeat the question.
Yes, definitely. So as a result of like being asymptomatic, or with that, within the lights, sorry, I skipped the question. What do you think of Ontario government's lack of mandating masks in the increase of class sizes? Oh, we might have a bad connection, Dr. Dina. Uh-oh. I'm sure she'll be back, folks, not to fret. Please keep your questions going. We've had a little bit of the internet connection today, and it's not a normal occurrence, but on the same side, it happens. So not to worry. Great questions, though, you guys have coming in. It's been an absolute amazing pleasure having Dr. Dina on as well. So a couple of quick questions coming through. The CDC about classroom sizes in the daycare. I haven't checked recently about any of those ones. I have been reading, but it's tough. I know that everything has been changing left, right, and center these days. So it's not, it's not an easy go with figuring out what's really, everything's changing, right? You're never really knowing what the big things is. I think Dr. Dina has rejoined with us here, but not a worry. I also want to say, take the moment while she's reconnecting with us to every healthcare provider, no matter what job you do, no matter what sort of healthcare provider you are, thank you. Thank you, thank you, thank you for everything you do, for everything that you've been doing over the last several months, everything that you continue to do, and every teacher as well who's, working and is going back to work. It's scary times, but I think you guys are doing an absolutely phenomenal job, and please keep it up, please. Okay. It's been a hard go for all of us. And I'm really pleased that, everyone kind of jumped up and was able to, really pull together as a team. So just check in here. Dr. Dina, I think you made it back with us. We have a bit of a rough connection. I do apologize. So how about this? We do one question, big topic here, talking about pink eye. The thought of being, with pink eye and remember, so the question exactly is if we're with pink eye or beginning of pink eye being monitored on a child, what's the expectancy of you actually having COVID or it being COVID based, do you think? Oh, I think your audio might be off, Dr. Dina, sorry.
Am I back?
You're back. I'm sorry. No worries.
Yeah, yeah, well, thank you. Thanks for telling me. Because we're not really sure what are the numbers of, because the testing is viable and it's what symptoms, that's part of the problem here. And because we've seen so many kids with things like pink eye and stomach bugs and roseola rashes, et cetera, over the last few months, when kids were even in quarantine and had no other exposures to other children, the assumption is that a lot of these kids have COVID. But if a kid has pink eye, what are the chances that's COVID? Or a kid has stomach flu, or a kid has roseola? There's actually no way to know because there's no gold standard for the testing. So until we can tell that a test is very accurate, may not be 100%, but very accurate, it's impossible to know what symptoms are COVID. And that's why the assumption should be that everything is COVID. And there's no really way to prove it or disprove it until we have some better testing measures.
Fair enough. Fair enough. I'm going to ask you one more question just because we do have the time and I'm being very cautious about that.
Of course.
So Paula said, so she's heard that the viruses usually are higher transmitted through not so good ventilation in a room. Do you think that it's triggered with that? Do you think that, centers that potentially are 2 or 3 stories where they have a one in a basement, like a classroom in a basement, do you think that would actually play any part with transmitting COVID potentially throughout the whole center?
I think it's possible. We don't really know. We don't know much about COVID is the truth, right? We call it the novel coronavirus. We really don't know how we get it and how contagious it is. We don't know much because again, the testing isn't good. So if the end of it is we don't know who has what, it's hard to say where they got it from or et cetera. What I can tell you is I have suspicions that it goes through ventilation, and I could give you an example of why. Okay. I have a patient in the practice who is a single child, and he has a mother that cares for him and no other family members. And the mom has pretty significant OCD, obsessive compulsive disorder. By the way, she said that I could share the story, obviously with no names. But at the beginning of quarantine, they locked down in their apartment building and they literally did not leave. And because of mom's OCD, she was cleaning everything meticulously, all the groceries coming in, et cetera. They did not leave their apartment, not once, not ever. And mom got a fever, about 3 or 4 weeks into COVID lockdown, with testing positive, got tested in a hospital. Child developed fever and runny nose, got tested, was negative. But again, as I'm telling you, I think the child probably had COVID, but they had not left their building, not their apartment, not once, not a single time in 3.5 weeks. So where did it come in? I don't know. The food that she was cleaning meticulously, or maybe the ventilation, we don't really know, but she got it. I mean, the alternative is that perhaps the incubation period is longer than we think, which people are touting 2 weeks, 14 days, but perhaps it's longer, perhaps it's up to 4 weeks. So there's a lot that we don't know, but I have spoken to many, many families who hadn't left the house, especially during quarantine. Like now we're more out and about, but during quarantine, many of us were not leaving and got sick in those first few weeks or even 2 or 3 months into it, had no contacts with any other sick people. And so I think it's much more ubiquitous than we think. And I think it's likely on surfaces and likely in the air in a more significant way than we think. Fair
enough. Before we wrap up,
which is a scary thing. It's a scary thing.
I was just like, maybe I'm going to open my windows. Yeah. Before we wrap up, is there any piece of advice or anything you want to leave the audience with. And before we do, while you were reconnecting, I was saying just thank you. Thank you to your staff. Thank you for everything as a healthcare provider in whatever variety, shape, form, size, whatever it is they're doing, especially at your practice and all around the world. Thank you, thank you, thank you for all you do, especially for just keeping us all safe and healthy. Yeah. But is there anything fabulous you want to leave us with today?
Yeah, sure. So two things. One is I heard you talking about stresses, et cetera. Actually, ironically, I happen to be hosting a free webinar tonight, actually. So if people want to learn more about how to get the best sleep from your kids, or decrease meltdowns and temper tantrums, or have a better mealtime experience without battling, et cetera, I'm actually hosting a free webinar tonight. So perhaps I can send it to you guys and we can link to it. But
we definitely can.
So it's parentplaybook.co/webinar, parentplaybook.co/webinar, and you guys can link to that and I can send it to you as well. But yeah, totally free webinar, 8 p.m. Eastern Standard Time. And it'll be myself and a friend of mine who is a sleep expert talking about getting better sleep, getting better meal times, decreasing temper tantrums, kind of sharing some of our tips and tricks. So it could be helpful, especially in this stressful time for many families. But I do want to leave you with the thought, because I think maybe I'm scaring you guys into thinking that COVID's everywhere and it's scary and whatever. But at the end of the day, most people are doing incredibly well with COVID, right? Most, like 99% of people probably, they're very minimally symptomatic. They have a runny nose or cough or a bout of diarrhea, or they have no symptoms whatsoever. There's very few people percentile-wise that are doing poorly with COVID. Very few kids, especially, there's almost no kids around the world that have gotten very sick. The death rate for COVID from in children is incredibly low, lower than pretty much any other virus we could think of. So in general, kids are doing really well. Adults are doing really well. It's scary because it's difficult to prevent, and it's scary because there's so many people in the world with it. It's not causing a lot of death, especially in young people. So I think we have to be cautious. We spoke a little bit at the beginning. We don't know what the long-term side effects are, and that makes some people quite uncomfortable. But in general, people are doing really well with COVID. So we should be cautious. We should be vigilant. We should be careful. But I don't think we need to be so anxious or stressed about it. For a lot of people, it's the unknown. It's the lack of control that makes people feel uncomfortable. We want to control our environment, especially as parents. We want to control what we can control, keep our kids and ourselves as healthy as possible. And there's an element of not having control here. I think if I told you, for sure, 100%, COVID will be gone in 18 months, 2 years, 2 months, whatever it is. It could be 4 years from now. But if you knew with 100% certainty it would be gone in that period of time, we would all relax. But it's we don't have this light at the end of the tunnel piece, and that makes people really uncomfortable. So, take the time to love your family, be with your loved ones, keep being vigilant so we keep everyone healthy. But there is a light at the end of the tunnel. We just don't know where that is. And again, if we're patient about it, it'll come sooner than we think.
I think the big key takeaway from me today is just be patient and to just kind of, maintain status quo and keep going. Yeah. Dr. Dina, thank you. Thank you so much for everything, for being on with us today and for taking time out of your day-to-day practice right now to be with us, answer our crazy questions. And it's been an absolute pleasure, honor. I've heard so many amazing things from all of my coworkers about you who are patients of yours. And so it was really nice to finally put name and face together. For the wrap up here, of course, this is the big thing for everybody. They all want to know, what time is your webinar tonight, actually, Dr. Dina?
Yeah, 8 p.m. Eastern Standard Time. And you have to register. It's not just jump on Facebook or jump on Instagram. It's going to be a proper webinar. So you have to register with that link that I was providing. So parentplaybook.co/webinar.
It's in the sticky banner, everybody. So we got that up there for you. So if you want to, on for certificates for today, you guys can go ahead and get those out now. They're in the files. You can download it, save it, pop your name in, pop your center name in, away you go. If you miss it, it will be in tomorrow's show notes. So don't stress. It will be there. You will get it eventually. Next up for us next week, like I mentioned, show notes and recording tomorrow. But next week, Miss Kaya's coming back on. We're bringing her back, talking about balancing classroom, that whole thing right now is the classroom live and being, virtually up there. So I'm super excited to bring Miss Kaya back and have her on. Last but not least, don't leave yet. We want to make sure, if you have never done this before, and I don't know if Dr. Dina, if you've ever heard about our benchmark report, we do this. This is year 5, I think, if Carmen, correct me if I'm wrong, year 5 with this. We'd love your input. It's a fantastic, this is a one-of-a-kind survey, and really you don't find it anywhere else. So please take some time to fill it out. We'll make sure you guys get links and everything there. please, 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 we'd love to have you guys fill it out and get some better, information. And along with Dr. Dina, if you're looking for her, follow us on social media. We're like Hi Mama app and Hi Mama anywhere else. I won't lie, guys. Like, I don't do Instagram, but anyways, it's key trick to me here. I'm just simple. But look us up. If you're looking for any more information, you can definitely find out. We can send some information on your way about Hi Mama if you're interested. Last but not least, thank you, Dr. Dina, for joining us again today. Thank you for everyone coming out. There's 1,200 people here on the webinar today, so fantastic. Thank you so much for everything today. And Carmen, I don't know if you want to jump on and leave us with anything. Did I miss everything?
Yeah. No, you didn't actually. Hey, Dr. Dina, thanks so much for spending some time with us. I know you had to take it out of your busy schedule, and good message there. If you can, everyone, stay home, stay safe, and we'll get through this together. And thanks everyone for spending your afternoon with us.
Take care, everyone. See you next Thursday, same time, same place. Thank you, Dr. Dina. Bye, everybody.
Be healthy. Bye, guys. Thanks for having me.